didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No,
Medicaid
the head of the CDC, that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person?
You said you wouldn't, and now you did. Senator Elizabeth Warren confronted Robert F. Kennedy Jr. over his promise to protect vaccine access, challenged his defense of the new COVID policy, and then turned up the heat over a CDC official who was fired after refusing to support his changes.
Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
The policy changed further after this confrontation. On October 6, 2025, the CDC adopted individual-based or shared clinical decision-making for COVID-19 vaccination instead of a universal recommendation. The FDA's authorization was limited to people 65 and older, or those with at least one risk factor for severe COVID-19.
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is, everyone who wants it, that was your promise.
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
You want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
And this issue became even bigger in the months that followed. Kennedy replaced all 17 members of the CDC's Vaccine Advisory Committee, ACP, in June 2025, and HHS announced 5 new members in September. The reconstituted panel then moved forward with changes to federal vaccine recommendations.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses. And let me get
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
The biggest development since this exchange is that the administration's COVID vaccine policy has continued to move toward risk-based and individual decision-making rather than universal recommendation. The FDA's current approvals limit several COVID vaccines to people 65 and older or younger people with at least one condition that places them at higher risk of severe COVID-19. For example, the current FDA indication for Comirnaty covers people 65 plus and people ages 5 to 64 with an underlying high-risk condition. New Vaxovid has a similar 65 plus / high-risk 12 to 64 framework. The policy has continued evolving in 2026. The FDA's advisory committee recommended the 2026 to 27 COVID-19 vaccine formulation for the fall of 2026, selecting a JN.1 lineage XFG variant as the preferred strain. At the same time, HHS has continued reviewing how vaccines should be recommended and communicated. Most recently, HHS began seeking public input on broader changes to federal vaccine guidelines, including questions surrounding shared decision-making and the childhood immunization schedule. That makes Warren's confrontation with Kennedy particularly significant because she was testing whether Kennedy's confirmation promise matched the policy he was implementing. Before becoming HHS Secretary, Kennedy had told senators that if vaccines were working for someone, he would not take them away. Warren used that statement as the foundation of her questioning. Her argument was straightforward. If a person can no longer simply walk into a pharmacy and receive a vaccine under the same conditions as before, hasn't access effectively been restricted? Kennedy rejected that characterization. He repeatedly insisted that he was not taking COVID vaccines away from anyone. His position was that people could still obtain them, while the government should not recommend a product for an indication for which he said there was insufficient clinical data. That distinction became the central battle. Warren wasn't merely asking whether vaccines technically remained available somewhere. She was pointing to the practical consequences of changing federal recommendations. If a vaccine moves from a broadly recommended product to one requiring individual clinical decision-making, access can become more complicated. Insurance coverage, pharmacy practices, state rules, and eligibility requirements can all affect whether someone can actually receive the vaccine. That is why Warren kept returning to the words, anyone who wanted them. Kennedy, however, interpreted his earlier promise differently. He argued that refusing to recommend a product without sufficient evidence was not the same thing as taking the product away. That is an important distinction to preserve when describing the exchange. Warren's strongest point was therefore not necessarily that Kennedy had literally outlawed COVID vaccination. Rather, she was arguing that changing the recommendation and eligibility framework could make vaccination harder to obtain for some Americans, contradicting what she viewed as his earlier assurance. And subsequent FDA policy shows why that argument became consequential. The FDA's current vaccine indications are indeed substantially more targeted than the broad eligibility framework Americans became accustomed to during earlier phases of the pandemic. But there is another side to the debate. Kennedy's argument was that federal health agencies should not automatically recommend vaccination to every demographic without evidence supporting the benefit-risk balance for that particular population. The FDA's later regulatory framework similarly distinguishes between older adults and younger people with underlying risk factors. That means the disagreement wasn't simply vaccines versus no vaccines. It was fundamentally about who should be recommended to receive them, what evidence should be required, and how much responsibility should be placed on individual patients and clinicians. Warren then broadened the confrontation by bringing up Kennedy's relationship with CDC leadership. She pointed to the abrupt departure of CDC Director Susan Menares and questioned whether Kennedy had pressured her because she resisted changes to the childhood vaccine schedule. Kennedy gave a completely different explanation. He said Menares had told him she was not trustworthy, and therefore he asked her to resign. Warren immediately challenged that account, pointing out that Kennedy had previously described Menares as unimpeachable and said he had confidence in her. That created a second confrontation inside the same hearing. The issue was no longer only COVID vaccines. It became a question of who controls federal vaccine policy and how much independence career scientific officials should have when they disagree with the Secretary. That question remains highly relevant because HHS is still reviewing the federal vaccination framework in 2026. The department's latest review includes potential changes to the childhood schedule and how recommendations are presented to families. At the same time, the FDA continues to approve and update COVID vaccines rather than eliminating them altogether. The agency's 2026 to 27 formulation process demonstrates that COVID vaccination remains part of federal policy, but under a more targeted regulatory framework. That is why Warren's accusation that Kennedy was simply taking away vaccines needs some qualification. The more precise description is that Kennedy's administration changed the federal recommendation and eligibility framework, making access more targeted for certain groups rather than universally recommended. And that is precisely why the argument was so heated. Warren viewed the change through the lens of Kennedy's promise. You said you would not take vaccines away from people who wanted them. Kennedy viewed it through the lens of scientific evidence. You cannot demand that HHS recommend a product for every population without sufficient clinical evidence. Both sides were therefore arguing from different definitions of what access means. For Warren, access means being able to obtain the vaccine easily through the normal healthcare system. For Kennedy, access means the vaccine remains available while the government determines which groups should receive an official recommendation. The consequences of that distinction are not trivial. A recommendation from federal health authorities can influence insurance coverage, pharmacy availability, physician practice, and public confidence. So even if a vaccine remains legally available, changing its recommended population can substantially alter how easily people obtain it. The later FDA framework demonstrates that this was not merely a theoretical disagreement. COVID vaccines are still available, but the approved populations are now more specifically defined. There is also an important irony in the exchange. Warren accused Kennedy of breaking his promise by restricting access, while Kennedy accused Warren of demanding that he recommend products without sufficient evidence. Neither argument completely eliminates the other. A government can preserve physical availability of a vaccine while simultaneously making it harder for certain people to obtain through ordinary channels. And a health secretary can legitimately argue that recommendations should be based on evidence rather than political promises. That is the real policy question underneath this confrontation. Should federal health officials prioritize maximum vaccine access for anyone who wants protection, or should they narrow recommendations to the populations where they believe the evidence shows the clearest benefit? The answer has enormous consequences, not only for COVID vaccines, but potentially for the entire childhood and adult vaccination system. And that is why Warren's final demand that Kennedy resign was more than a dramatic closing line. She was arguing that his approach represented a fundamental threat to America's vaccination infrastructure. Kennedy's response was essentially the opposite, that his responsibility was to change federal recommendations when he believed the evidence justified doing so. The subsequent policy developments show that this disagreement did not end in that hearing. The federal government has continued moving toward a more targeted risk-based vaccine framework while still approving and updating COVID vaccines. So the most important question coming out of this confrontation isn't simply whether Kennedy took away COVID vaccines. It is this: when government changes a vaccine from broadly recommended to selectively recommended, is that responsible evidence-based medicine, or does it create an access barrier that effectively takes the vaccine away from people who previously relied on it? That is the debate Warren and Kennedy were really having.